Welcome back to Ohio Counseling Conversations, the official podcast of the Ohio Counseling Association, bringing you updates and conversations from around the state. On today's episode, we are joined by Michael Desposito. Michael is a licensed professional clinical counselor with supervisory designation in the state of Ohio, Certified Dialectical Behavior Therapist, and an adjunct professor at a local university in Canton, Ohio. He is also the co-owner of his own private practice, the Well Life LLC in Canton, Ohio. He has served in the mental health field for the past 10 years with experience supporting at-risk youth transitioning to adulthood, severe and pervasive mental illness populations, dual diagnosis populations, emotion regulation and grief, LGBTQI+ populations, and facilitating creative expressive group programming in mental health inpatient settings. Michael has held several executive leadership roles in professional counseling organizations and has over 30 plus presentations at national, state, and local venues on a number of topics, including emotion regulation, mood disorders, affirmative therapy, and pedagogy practices for LGBTQI+ populations and wellness. As always, I'm your host today, Dr. Marissa Cargill, a counselor at Cuyahoga Community College in Cleveland, Ohio, and counselor educator at the University of Akron. Thanks so much for joining us today. Let's dig in. Welcome back to Ohio Counseling Conversations. Today we have joining us Mike Desposito. Mike, thank you so much for joining us today. We're going to kick it off with just tell us a little bit about yourself and the experiences you've had in the counseling field.
Yes, and I want to thank everyone for inviting me to the OCA podcast. I love all the things that have come out so far, so I'm excited to be here today. I am a licensed professional clinical counselor with supervisory designation. I co-own and run my own private practice here in Canton, Ohio, known as the Well Life LLC. And I've been working in the field, my goodness, for a long time. Graduated in 2018 from Bowling Green. Shout out to my old professors, Dr. Lon and Rose, really strong advocates and mentors in my life. And just been really excited to do this work and to talk a little bit about emotions and why they matter.
Awesome. Well, we're excited. And I know in some of our earlier conversation today, you said you're really hopeful that this conversation can empower counselors. And so just that word alone, that verb, I love, and I'm excited and hope the same for this. So when we invited you to join the podcast, you mentioned one of your favorite topics was really emotional regulation or dysregulation. Help us understand that passion for the topic.
Yes, well, I think it's hard to really define emotion regulation unless you talk about emotion. And it's so funny, like if you try to define that word, like there's probably 1,000 theories and definitions. And so it's one of the reasons it's one of my favorite things to talk about and also to work with clients is emotion really kind of conceptually like encompasses so much of human life experience. I like to think of it as like the painting, if you will, the color on the art brush. And I think it gives so much life to therapy in general. And also, we can have so many unique experiences with emotions. So, for example, like two people can go see the same movie and have two different emotions from it. So, I find when you define emotion regulation, that really easiest way I try to help clients even understand is it's just the process of how an individual influences their emotions, whether how they have them, when they have them, how people experience and express these emotions. There's a lot of fancy words out there, but I find emotion regulation kind of hits those three areas.
Awesome. So what advice would you give to counselors to better understand the topic of regulation or dysregulation?
Yes, that's a great question. I would say the first thing is not to be afraid of them. I think a lot of times you will see a lot of different types of emotions, whether that's maybe guilt or shame. Sadness, I think, is one of the harder emotions to maybe work with. People have a hard time with sadness, one, to work with, but also when someone feels it. And sadness uniquely is such a beautiful emotion. It really helps people take time to reflect and understand maybe why something's not working in their lives, or maybe a different direction to go. But often it is stigmatized as one of these like really horrible emotions. And I think that's one thing that I want to help empower counselors is emotions are not by definition disordered. Emotions are very much, like we talk about emotion disorders, those are likely just emotions that stay too long with somebody. And if you think about like diagnostic criterion, you normally diagnose something within 6 months. I think depression's maybe 2 weeks. There's some reasons for why that's different. But a lot of times, a lot of what we work with is emotion regulation with most clients. And in fact, the DSM-5, I want to say about 85% of all of the disorders in that have an emotion regulation, dysregulation component.
Mm-hmm. I like what you said there, that like sadness can be beautiful, but it's often like very stigmatized. It's tough because that is a normal reaction to some of the human experience.
Mm-hmm.
Yeah.
Absolutely. I want to shout out my one of my friends, Kaylee Bradley, who I know helps with this podcast, and who is a grief expert, I would say. And a lot of times there can, not always, but there can be sadness with grief. And it's a unique experience to help people process.
Mm-hmm. Yeah. Yeah. I mean, I'm just digesting that, but that's so like important for us to digest. I agree. So, and appreciate the shout out to Kaylee. She's such an excellent team member, both for her knowledge and the work she does on the podcast. So shout out Kaylee. Um, you mentioned that you also are really passionate talking about transdiagnostic therapies, and that they're particularly important to you. Tell us more about that.
Yes, and thank you for kind of that segue into this. I think there's two things I want people to kind of know about transdiagnostic. One, it's a confusing topic, but it really is, I believe, the future of what we're going to be seeing coming down the pike in counseling. Transdiagnostic, just for kind of like defining what that is, really focuses on trying to understand maybe like a higher order factor behind the disorders. So instead of looking at something as depression or anxiety, we're looking at these factors underneath them. And for anyone who probably works in the counseling field, they might have noticed sometimes maybe a client presents with anxiety, and then 2 weeks later they're presenting with depression symptoms, or they're with maybe rumination symptoms. One of the things I've done presentations at All Ohio, and I talk about when someone says they have difficulty concentrating, what are you really looking at? And, I find what I like about transdiagnostic is it's a little more open and broader. Whereas a lot of times when we look at this diagnostic criterion, we miss so much. It's very, and I understand why it has come from that historically, but it really pigeonholes somebody into a specific way. And often the therapies that we've done have been researched to target a specific issue. Whereas transdiagnostic seems to be, and the research is starting to become more clear on this, it's really hitting a broad stroke of these underlying factors and is giving people true freedom from these things. I find another piece to that as well is if you understand transdiagnostic, you're probably going to start seeing these. So like a lot of times when I say transdiagnostic, I kind of lose people. So I like to say, well, you probably have heard about dialectical behavioral therapy, of which I'm certified in DBT. You might be familiar with acceptance and commitment therapy, or mindfulness-based cognitive therapy. These are some of the newer third wave behavior stuff coming out, and all of it is addressing these higher order factors.
Yeah. So almost like the symptoms more important than the diagnosis in a lot of ways from this approach.
I would actually go even deeper than that, which is the symptoms are normally underpinning maybe a deeper piece to that.
Okay.
And so a lot of times what you see as a symptom might actually be uh, one of a constellation of different things that is coming from underneath.
Mm-hmm. Mm-hmm. There's way more layers to that onion, that need to be peeled back to fully understand. Okay. Um, a lot of the training and some that you just mentioned, really talk about like trauma informed approaches to supporting people. And that's the theme that's been coming up in some of our recent conversations on the podcast. What do you think it means to be trauma informed?
That's such a powerful question too, because I would make the argument that trauma is transdiagnostic. And so it just kind of teaches to what we were just saying. A symptom of anxiety might be maybe showing up as like hyperarousal for a client, but how much are we truly missing if we're just addressing the anxiety, quote unquote, disorder? And so it's almost like we're missing the client's story a little bit if we are really targeting one symptom. And what I love about counselors, and what I want to empower them to not be afraid of this topic, is we already are doing a lot of transdiagnostic work. One of the reasons for transdiagnostic therapy is a lot of these old ways of doing things ignored context.
Mm,
And counselors, by
yeah.
definition, honor the multicultural and social justice competencies.
Right. We have to be aware of what's not just happening internally, but externally within systems. And also, like, even when we're talking about internally, there's more than just one layer there. So definitely. Um, so beyond transdiagnostic, is there anything else that you feel like is really valuable when we think about taking trauma informed approaches with supporting each other, our clients?
Absolutely. Well, and I think it might be helpful to like maybe use trauma as like a teaching component to all of this transdiagnostic language, is really to discuss how, like, when you think about trauma informed care, one of the most important things is the therapeutic relationship. And safety is huge in trauma informed care. One, transparency between the client and the therapist, giving that structure and that support, but also allowing them to feel comfortable, because trauma is a tough thing to kind of work with and to live. And so one thing that's so powerful about that is a lot of these diagnoses that maybe people have gotten over time is actually missing the whole boat altogether. I'm certified in DBT, so I do a lot of work with those diagnosed with borderline personality. And often, if you look at the research on that, these prolonged states of high emotional arousal um, often have a root in PTSD. And so, what I love about being trauma informed is, DBT provides, for example, a structure, and part of that whole reason is safety. Safety for the client to know a relationship is stable, but safety to know that there's hope too. And that's what, again, I love about this idea. It's not just like you are a symptom or a disorder,
Right.
there's hope at the end of the tunnel.
Yeah. You're a human with the ability for growth and change. And me looking at it from this lens helps me give that to you.
Absolutely.
Okay. I love that. Um, I think you've already hit on this a bit, but like, why is it important for counselors and for clients to be aware of the different modalities that integrate like trauma informed care or transdiagnostic therapies?
hmm I find that that's like so I can talk about another type of therapy too, because I'm trained in EMDR, eye movement desensitization and reprocessing therapy. And that is such a structured approach that takes and encompasses so much of kind of looking at the full picture. I really love that kind of standardized approach for that reason. Not only is it evidence based, so it helps therapists, with that reimbursement that they need to survive, but it also gives the client hope, and it operates from this assumption, very similar to almost all transdiagnostic therapies, that clients naturally want to get better and they want to heal. I want to say EMDR, I think, is based in like some adaptive information processing therapy, for anyone who probably knows that better than me. So that whole model talks about how people want to move forward and they want to heal from these pieces, instead of looking at them as, unfortunately, maybe historically broken.
Yeah. Yeah. Looking at them um, is a more well or wellness oriented person instead of the alternative. Definitely. What made you want to pursue like the additional training tied to all of this?
That is such a unique question, because I think about, and I always like, let's picture this. It was 2020. And I don't know if anyone else remembers this global pandemic that we all went
I
through.
think, yeah, I can recall that.
um, but on the clinical end, I noticed such a dramatic increase in severity and symptoms showing up in my office. And it just so happened that I wasn't getting much feedback at the time from the practice I was at. There was no, and again, that's no disrespect to them. I think we were all in the same boat of like, what just happened? But what I noticed for me is like, we can talk about things conceptually, but I really lacked tools to help clients really engage that hope that they needed in such a tough time. Nobody knew what was going to happen, when you go back into 2020. And that's when I started pursuing DBT training. It seemed to connect a lot with what I was seeing. I was having a lot of clients show up with emotion dysregulation, and DBT just so happens to have established evidence protocol for suicidal ideation and how to address safety concerns. And that's what I was getting a lot of at the time coming into my office. And so I wanted something that had a toolkit practically, but also honored that hope for people. And that's what I noticed about
Yeah.
Transdiagnostic.
Yeah. Okay. Yeah. So, and this is a podcast that we hope helps all counselors from any stage in their career. Uh, it sounds like from what you're saying that as you entered this career and then we have this global pandemic, that there was this maybe like lack of practicality that needed to be there. So I guess like that's helpful for all of us, no matter what stage we're in. But what's the best advice you would give to someone who's seeking maybe some of that practical training like EMDR or DBT?
I think the first thing is not to panic. I think sometimes, like when I go back as a dependent licensed counselor, LPC, my first thought at the time was like, I'm so far behind. And I think a lot of people feel that way. When I was in my master's program, my cohort, we used to make the joke that we were on track to practicum or on track to prac. And so we just needed to get to practicum. And then we got to practicum. We said, whoa, we're not ready for this.
Yeah, this is
And
different.
so, yes. And so I find there's so much pressure at imposter syndrome about what are these things. And what I really needed at the time for me, I can't speak for everybody, but what the practical piece gave me was a guiding framework. I was trained in cognitive behavioral therapy. That's kind of what I got a lot of when I first entered the field. And I don't think it was a distorted thought when we were going through the global pandemic. We all were scared. We didn't know what was happening. And so there was this perspective that you can't really work the same way you were at the time. And my focus has always been on emotions, as that's an area I really respect. I think it colors things so much more beautifully. So to honor that versus saying something was wrong with that was something I really respected for my clients and for myself.
Yeah, these are normal reactions to this
Yes.
experience, this collective trauma, really, in a lot of ways, and collective uncertainty at the minimum for all of us. So, both as a profession and as a society. So, definitely.
Yeah. And I think just to kind of piggyback a little bit off of like, if people are seeking these trainings, because there's hundreds of them, I really respect for people to really identify maybe a mentor. That was really helpful for me, but also maybe to identify what they want to maybe pursue. So for me, I always knew emotions was something I really valued. Starting as a caseworker before I was in mental health, I saw a lot of that. I worked with severe and pervasive mental illness is the words they use. And I worked with adult transitional youth. And so a lot of my experience was, I don't think it's kind of to the point, it's a common human reaction to maybe be panicked if you're going through 10 major life adjustments between 17 and 30. And so instead of like diagnosing that, I wanted to find something to honor that for people.
If you're wondering how you can stay up to date on Ohio Counseling Conversations' newest episodes, consider subscribing to the podcast wherever you listen, as well as following the Ohio Counseling Association on Instagram or Facebook. It's a great way to stay connected. Additionally, consider bookmarking the OCA's Linktree so you can easily find links about conference details or the official OCA newsletter, The Counselor Connection.
You mentioned the mentorship piece. And so I would just ask if we could dig into that a little bit more. I'm wondering how you went about finding a mentor, or what are some, I guess, tangible steps that you might give to someone who's seeking that.
Yeah, well, and I think it's different for everybody. They say like kind of when the student is ready, maybe the teacher or the mentor appears sometimes. So, I think the first step if you're in a master's or doc program is your first access to really the community is your professors. And kind of how I got involved with OCA leadership in 2016, I was offered an opportunity to maybe join and be access to a board and be a part of maybe a higher leadership role. There was some changes with it was Albatech of Ohio, now Sage of Ohio, or Sageo, which I love that board. And so I was a master's student and I had this ability to be the president at the time. And it was all done through my mentor supporting me and encouraging me, hey, it's going to be okay. You can do these things. And then at the same time, I was able to, and I'm just so thankful for the opportunities, but I was able to become an emerging leader for Sage National. And so I got sprung in 2016 into all of these different experiences. And I really am humbled by the people doing the work. Number one, you meet so many people that are fighting the big fight. LGBT, QI plus advocacy is huge. I'm an affirmative therapist by trade as well. And so I find it was really crazy to be meeting the people who I was reading the articles on. And so I find many times it's just you can start with your professors. And as I started joining these boards, I started developing relationships with people, and then they continue to encourage me. I'm currently the East Ohio Counseling Association president. I wouldn't have been there if not for Dr. Sherdine Simpson, who had faith in me. And I was like, I don't know what you're talking about.
Well, we love her, our current president, and I think that similar to you, there's this like goal of empowerment from her approach in supporting students and clients as well. We've been fortunate enough to have her as a guest on the podcast too. So this is a perfect segue into some of our next questions. Is that like you have been actively involved in the Ohio Counseling Association and the American Counseling Association in leadership roles. And in general since 2014, you told us. So outside of mentorship, what was it that made you want to get involved?
It's interesting. I think it's kind of like the question of like, what does it like, how do you get a benefit from it too? Because like, what is these professional leadership roles? And I think the short answer to this is I believe there's a benefit that counselors support each other. And so one of the reasons I wanted to be involved is I wanted to kind of be where the people were. I think by definition, one of the strongest things counselors do is that we advocate. And so I found so much access to, just by definition, being that I think counselors are the strongest advocates in this stuff. There was so much work that I was seeing being done. And I just wanted to be a part of some of those roles. And I knew at the time, the only thing I knew is that I wanted to support the LGBT community because that was a big piece. And it just so happened that there was this opportunity. So I think sometimes if you go in, like I think about like master's level, and you just say, hey, I have an idea or I want to get involved,
Mm-hmm.
I think there's opportunity there.
Yeah. Yes, definitely. And I can recall like some of my own experiences of like my first time attending All Ohio and just being willing to talk to anyone. Even if it's another student, like, but you'll find that there's professionals, there's counselor educators, there's a lot of people that you have access to by getting involved. Yeah, awesome. Well, to continue on with that, like, what are the benefits? You said like kind of what do you get out of it, but like, what are those benefits that you feel like you've gained from your involvement, both as a member and leader? I'll leave that open, but you can answer it as you
we'll
see
give
fit. Yeah.
we'll give the long answer.
Yeah.
Well, and I think you can get involved at any stage because I know I kind of gave a lot to like my experiences with this as a student, but even as a clinician, I remember when I needed resources to kind of help my clients. And one of the things that Sage of Ohio did for a long time is they had these regional resource lists of people that were in some way a little vetted to be supportive, hopefully affirming towards helping those in the LGBT plus community have access to affirming care and not to have stigmatization or discrimination. And I really respected that, because then I had this list that I could print out and talk to clients. I could call them myself. I established relationships with people in the area I was in just by doing that to help my clients. So I find as a clinician, you can get involved. A lot of the things that you might need out, I'm in a private practice now, but even an agency, to know like where are the places that people need.
Yeah. Yeah. Having access to resources, people for consultation, all of that can be really useful. Uh, what are some maybe other personal, professional, clinical benefits that you have, feel like you've gained?
Yes, I think there's two that are, I think one is more understood and the other one I think is more implicit. The one that is probably more explicit is this: we have a really strong advocacy arm in terms of lobbying and the government relations committee. And I really respect knowing that information, because it's translating directly to how we practice. Some of the laws that are coming out, good or bad, for example, like the Counseling Compact, is directly going to be impacting us here in, if not a year, I think a couple of years when they iron it out. Like we've never had portability. So the fact that like we're moving in that direction and Ohio is able to stand in those meetings is so powerful. I remember talking about it because I lived very close to Michigan before I moved to Canton. And, there was a moment in 2019 where they almost lost the ability to diagnose up there. And so how powerful it is that we have such an arm that's fighting for us. That is right there. Membership dues alone is helpful to just give to the people going to those meetings. But I think implicitly, another thing that was so powerful is I made some of the greatest friends I've ever can even. I still have. I use this app called Marco Polo. It's kind of similar to FaceTime and maybe like a Snapchat, but for more professional. So I have a group, and we all will Marco each other, like what's going on in your life, what skills working for you this week. And some of those people I met back in 1819 at an All Ohio conference.
Yeah. Yeah. So there's this camaraderie. There's also this huge advocacy piece of even like helping us maintain like our boundaries of professional practice, but maybe even expand them in some ways, um, like with the Counseling Compact, for example. So yeah, it sounds like there's been quite a few, and I'm sure if we had hours upon hours, we could probably just talk about all of the like little nitty gritty details of all of that too. But this is, I think, a great message for listeners to understand. Like, it's not just like a line on your resume. It's actually going to add value in terms of your clinical practice, giving you access to resources personally, because you're going to have support more than maybe you had, and professionally, in the sense that like we have that advocacy, we have representation, and we have certainly CEUs and things like that too that we have at those conferences and beyond. So that's really awesome.
Absolutely. And I think there's such a value of one of the things I'm very passionate about in professional development on these boards and just being a part of OCA is emerging leader development. One of the strongest things a board can do is to be able to have members be able to move on from those boards and have the next generation come in. And so I know I've worked to establish emerging leader programs in a couple divisions, and I love that OCA now has a leadership certificate. Shout out to that leadership certificate, because to really engage the profession and to engage the next generation of counselors, they have to know, one, that they have an invitation. I think an invitation in a space makes such a difference, but also that their voice matters. And unfortunately, I think, things like pandemic and things maybe that are not in control, but also sometimes are not helpful for counselors. We haven't always been given the ability to have a voice. So to give them that empowerment is so important.
Yeah, I appreciate you saying that. And I know, I think when we think emerging leaders, we think younger, but that's not always like necessary, because this might be someone's second career or something of that nature. But to that point, it also represents the diversity and the competence that we really want in our field. And so what's some advice if an emerging leader is listening to this episode? What's some advice that you might give them?
I find there's two things. Is One is if you're looking for permission to reach out to that person or to join that organization, here it is. I want you to know that it is so powerful to reach out because your voice is deserved and needed. The other thing I find is if you find that you don't know where to start, one of the greatest things is to ask someone you're close to and see if you can get connected to that, whether that's a professor. I mean, I reach out to some of the OCA exec. It's probably not the best, but I reached out to him because I'm like, hey, I'm seeing this thing happening in the state. What do we do? And I've had such great experiences from the executive director, Dr. Shereen Simpson. I can shout out to all of the exec. I think they do such a phenomenal job at being relational.
Yeah, we're really fortunate here in Ohio to have such great leadership. So, and I think that that's been consistent, like for a long history. So we're very fortunate that in that way. So last question. I won't say it's the most important question, but we love this question dearly. So we ask it every time. The name of the podcast is Ohio Counseling Conversations. What are some important conversations that you think counseling professionals should be having with each other? And if you want to take it further, with their clients, additionally, and in the state or just in general?
Yes. So I think there are two needed questions. And the first one is kind of talking back to this podcast. I believe Transdiagnostic Therapies is the future, given the research that we're seeing. The current funding going on with the National Institute of Mental Health is starting to drive towards moving in this direction. The CEUs, if you go on pretty much any CEU provider, is starting to talk about these things. I believe counselors need to know that they are on track by already doing a lot of this. And I think you brought up wellness earlier. I did a presentation at All Ohio. Wellness is a transdiagnostic factor. It's not just for the worried well, it's for everybody. And so I find there's such a power that multicultural competencies, we're doing the work already. What can be hard is having that guiding framework. And I want counselors to be confident. That's why one of the things I know I've been doing is I'm doing some consultation work where I'm doing consultation and supervision work for people. My partner at the Welllife LLC is helping people establish how to get into private practice, to know and they can be empowered to do that. So shout out to All Ohio. Our presentation there is going to be on how to start your own private practice. Get in on the ground floor, because I think she's going to be selling it soon. So start with getting in on the ground floor for the CEU. The other thing I think that's so important right now is I do believe we need to talk more about our rates and our insurance reimbursement. Counselors are not being paid enough for the work that we're doing. And I also think that piggybacks off of something that I'm very passionate about, which is workplace rights for us. I think it's a no-brainer that we should be getting paid our worth,
Right,
so I
right.
shout out to the insurance advocacy committee and the governing relation work that's going on. I think we need to be having more of those conversations. But then the other thing that I find is very important we need to be talking about is our autonomy as practitioners. There is a movement towards non-competes in the state of Ohio and other states. I've been in conversations with the Iowa Counseling Association. They recently just instituted legislation to where non-competes will not impact counselors out there in Iowa. So I do think this is something that we need to be talking about, so it doesn't infringe on university policies for interns. It doesn't infringe on our ability to move places or have our autonomy, and also to honor our ethics. I find if we are talking about a counseling compact, we shouldn't be limiting ourselves because a business is concerned we might not be a return on investment.
Right. Well, and in turn, in that honoring of ourselves, it's honoring the clients that we serve as well.
Exactly. And so I find, I'm trying to get a Counseling Today article about non-competes. I know there's some stuff already out there, but I really respect some of the work being done through OCA. I know I just emailed them this morning about something that I just saw out there, but I find for us to know this, it helps our clients have access to care, and it helps us have access to being able to go where we need to go on our own professional journeys.
Yeah, that's powerful, and the work continues, right?
Yes, it does.
So, are there any other conversations you feel like we've missed that should be being had?
There are so many conversations that probably deserve to be had. I think you could have everybody that you've already had on the podcast on about 10 more times. So
That's so true.
shout out to all of them, right? Stacy, Chase, Morgan, Sweeney. I love all the people that you've already had on. So I think the first step is a conversation we all could be having is knowing that there's an invitation to get involved.
Mm-hmm. Yeah. And I appreciate that you shouted out like our past episodes, because I think legislation, even if it wasn't a direct theme or conversation, it was an undercurrent of what's something that's important to be discussed. And no matter how you feel about something, what we know is that those laws will impact the work that we do and impact the clients that we serve. So we have to be aware, and we have to continue having conversations and continue advocating. So I appreciate it. Points are well taken. So before we wrap it up, are there any plugs that you'd like to make, websites, resources, or anything else that we've missed that you want to make sure you share?
Yeah, good question. I think, some of the things that I'm already passionate about, I think maybe I've already plugged it, but I know we are doing my old supervisor and I established mosh pit consultation. So there's going to be some stuff coming out. We are in a Counseling Today article, I want to say in October, about how to join we call it starting a mosh pit. So why it's important to be in consultation. So that way you don't feel alone out there. The Well Life LLC, I know my partner is establishing a private practice kind of boot camp and getting on the ground floor. If you want to be in private practice, I think that's something that's really powerful. But also, I want to shout out and plug the OCA, because I think there's something to be said about getting involved in this. Again, legislation changes, and so we can be empowered.
Yeah. And I'll do a soft plug here for that too. So with OCA, the All Ohio Counselors Conference is coming up. I don't know if this episode will be posted before the early bird rates are expired, but it will definitely be posted before the conference. So if you are considering it and can only make it for a short amount of time, there are volunteer opportunities for our counseling students to attend and maybe get some discounts. It's a really powerful experience to maybe learn specialty areas that you are interested in and things like that. So soft plug for that. That's coming up October 16th through the 18th.
Absolutely.
And you'll be there, right?
I will be there. We'll be presenting on how to start a private practice. So get it on the ground floor, get the CEU.
Awesome. Well, thank you so much, Mike. We're so happy to have had you, and we really appreciate you joining us for this conversation.
Thanks for having me. It was a pleasure.
Ohio Counseling Conversations is on a mission to make this podcast meaningful to you, and we can't do that without your help. A feedback form is linked in the show notes for this episode and is also available on the OCA link tree. If you have any recommendations for topics or guests or any other general feedback, you can let us know by using the form. We welcome your thoughts so that we can continue to develop the podcast and grow as creators. If you are interested in joining the team or being a guest, you can also reach us by emailing ohiocounselingconversations@gmail.com. We value your insight. Thank you so much for listening.
If you enjoyed this episode, please make sure to follow us so you can stay up to date with Ohio Counseling Conversations online and wherever you listen to podcasts.
This podcast is brought to you by the Ohio Counseling Association's Media, Public Relations, and Membership Committee and its podcast subcommittee. Views, beliefs, or references mentioned in this episode do not constitute an endorsement or recommendation by the Ohio Counseling Association. The views expressed by guests are their own, and their appearance on the podcast does not imply an endorsement of them or any entity they represent. Views and opinions expressed by guests do not necessarily reflect the view of the Ohio Counseling Association or any of its officials. Thank you.